morning, everybody. My name is Dr. Salman Waqar. I'm a consultant ophthalmologist at Moorfields Eye Hospital in Dubai, specializing in adult and cataracts and glaucoma. First of all, a very warm welcome to ESO 2024. I've got with me somebody very special, Dr. Mahnaz Shah, who's come to us from Karachi in Pakistan. She's had a very illustrious career treating both adult and pediatric glaucoma, both in the US and now in Pakistan, and we're very pleased that she's here with us to share her expertise at ESO. Welcome, Dr. Mahnaz, to ESO. It's a pleasure to have you here.
Thank you, Dr. Waqar. It's a pleasure and an honor to be here. The conference has been great so far, and I'm pleased to be here.
Thank you very much. So, Dr. Mahnaz, I just wanted to start by asking a few casual questions, just to try and understand how your career's been and where you envision glaucoma heading in the future. So I know we have a mix of delegates at our conference, from medical students to residents in training and consultants, and very experienced consultants as well. So and I know you work both in the US and in Pakistan as well. So I just want to start by asking, what motivated you to join ophthalmology, and then once you were in ophthalmology, how did you find your way to glaucoma in specific, and within that pediatrics glaucoma to be more subspecialized?
Right. So I think to start off with, I think ophthalmology is fascinating. And I think for all of us who practice ophthalmology, it grows more fascinating every year, no matter how many years we've been out there in practice. And additionally, in ophthalmology as a specialty within medicine, it allows you to have very engaging relationships with your patients, a very long term. And while you take care of them and you do what is most intense and acts of commission, like surgical procedures, it's also an ability to continue to follow that patient and to see their care and to see the impact that care for all of the individuals who've cared for them has had on their lives, and the ability to become really a part of your patients' lives. I think that to me is something I enjoy a great deal. It's also an evolving field. I don't think there's ever a time that we can sit back and say, you know, we have this down cold or we know this. So there's always, you're always pushing yourself, learning more. Meetings like this, you come to every meeting and then you always go back with something that you have as a takeaway point that changes your practice for the better. So something I think that motivates you to always think out of your own person, to say, what can I do, or what can my colleagues and I do that is going to improve someone's life. So I think it's an enormous blessing, and I love ophthalmology for that. That's
very true. We're very, very lucky to be working in the field, that's for sure. And when we look at your career, so you worked in the US and now you're working in Pakistan. And like I said, we have a mix of delegates, residents as well, and medical students aspiring to go into ophthalmology. And when we look at a field such as ophthalmology, what do you find are the differences in practice? I know that in Pakistan, for example, you worked at Khan and now you have your own practice at the eye clinic. And what are the differences when you're working in a large tertiary center versus working in private practice? And what have you learned, and what tips can you share for aspiring ophthalmologists, you know, with all this breadth of experience?
I think it's a really interesting question. So I was born in Pakistan, and I trained for my medical schooling and for my ophthalmology training in the United States, and then I worked there for a while, and then returned to Pakistan about 22 years ago. So I've been there for that duration of time. And began working at a tertiary setup at a large university hospital. And then I think some part of perhaps an entrepreneurial bug hit me, and I wanted to start out a practice. And I also felt that we need more places in Pakistan. There's an enormous need for care at all levels. And that's when I started my practice as a single doctor practicing in there, and now it's grown to 9 of us representing different areas of subspecialty. But, you know, I think no matter where you're practicing, whatever field it is, I think you have to really accept one thing, that mediocrity is never going to be an option.
Of course.
And therefore, I think when you have a larger setup, you have the ability to be able to engage many more colleagues and provide multidisciplinary care. When you have a smaller setup, I think also you have to push yourself to the limit to be able to really do what you can do and what you must do for your patients. So that's been an interesting thing for me. I think care now pretty much is universal. And you know, when all of us, as we go through meetings, and you and I a short while ago were conversing about the wonderful meeting at Moorfields, there's just so much to learn. And wherever you go, from whatever part of the world you are practicing in, There's always something that you learn, something in a way that you can improvise or think out of the box or think differently. We had a couple of really great sessions, and then so many of us were conversing outside. So that's been there. But I think for younger ophthalmologists going into the field, I would say just know that this is an opportunity. I think it's very easy early on sometimes when you're doing so much work to get bogged down with the idea that there's just so much to be done and so much effort to be made. But when you look back at your life and you realize it's really an enormous privilege to have had, right?
Absolutely.
And when you're really tired on a particular day, you sometimes take pause and you say to yourself that there was once a time where I hoped I would be here.
Yes.
And I think that itself gives you a lot of perspective and a lot of happiness that
Yes,
that particular day
that's so
any
true.
day that you might be fatigued
Absolutely,
or
that's well said. And if we move towards more, our areas of expertise in glaucoma, there's been so many changes over the last 10 years. Of course, when we look back 20 years ago, there was perhaps just a trabeculectomy and a few drops, whereas now there's a plethora of drops, lasers, minimally invasive techniques. We've got so many shunt devices. So much happening in glaucoma. And it's a question that's always intrigued me, and I ask many of my colleagues as well, is where do you think we are with glaucoma treatment at present? So what is the state of play of glaucoma treatment? And where do you feel we're headed? So where would we be in 10 years? Or as you said, we're always aspiring to be better. What are we aspiring towards in 10 years' time to try and improve that treatment for our patients? Not only for the treatment, but also diagnostics as well.
Right. But I think it's really three arms of that treatment. And as you've alluded to, I think the diagnostics have gotten remarkably better. Our ability to pick up glaucoma and our ability to follow glaucoma, whether it's very early stage or really advanced disease, has improved and will continue to improve. So that itself is there. I think treatment options have certainly gotten better. I always think that now we've gone more towards where perhaps interventional cardiology used to be many years ago, and where we're now seeing that we're not really addressing damage that's been done as much as we are desire and the rightful desire to arrest damage. Right? So we're operating earlier. I think we're providing better outcomes. So certainly these surgical procedures are improving and becoming safer for the patient. And then again, also on the side of pharmacology, being able to deliver medications in depot forms within the eye to where compliance is not an issue. That, I think, is going to be, something very significant. And then understanding that glaucoma, how it affects the human brain, that's evolving on its own.
Of course.
So I think a better holistic understanding of the human body, of how we operate as human beings, what our needs are. I think glaucoma is not the same disease to two patients ever. As you and I sit within our clinics, we understand that the gravitas of the problem is different for different individuals, and our ability to address it will, I think, over time also get better.
Absolutely, and I think we can share for our audience as well that we were talking about the Moorfields conference recently in London, and one of the research discussed there was the impact of glaucoma on mental health, for example, and the prevalence of depression and anxiety is much higher in glaucoma patients than in the average population, and it fits in with what you exactly said, that we just don't know how it impacts people's lives, and then you're talking more neurologically how it's impacting the brain, etc. as well. So yes, absolutely, I think those are very exciting areas to look forward to. And I was very intrigued by your talk yesterday about GAT as well, and I know you have a lot of experience with it. What kind of results are you seeing, and is it a treatment that you're commonly using now for your patients, or do you have any tips you want to share with our audience, perhaps for people who weren't there for your talk yesterday?
It was really an honor for me to present on GAT, and I tell you about 4 years ago when I started doing the procedure. It was a procedure that had come around when I had finished my training. And so I was talking about this yesterday too. Sometimes it's really difficult to pick up something new that you haven't done, something that you feel, well, what I'm doing is working. Why should I actually go and engage in it? But I had an opportunity to fly out and spend about 2 weeks with Devinder Grover and Dr. Feldman and their group at GAT in Dallas, Texas. And to see the fascinating work that they did. They're really the inventors for the procedure. And the procedure really gives us a lot more options. I think getting flow through, there's so much that we don't understand in glaucoma yet about the actual outflow system. And to be able to optimize that, to be able to preserve conjunctival real estate so that we have greater options to go to for the lifetime of the patient, that to me is a promise that should be explored. It's something to be taken advantage of. And in that sense, I think it's a great procedure. It has its limitations where I don't think it's my procedure of choice to go to for very advanced glaucoma. In some select cases, yes, it still is a great procedure. But for the mild to moderate glaucomas, especially for pediatric glaucomas, for some of the secondary glaucomas, it's an excellent procedure. And it's a procedure that has its own learning curve, but not an insurmountable learning curve. And I have to say that my own experience, even from reaching out to the inventors for the procedure, has been that I remember doing my first procedure when this was the very first GAT being done in Pakistan, and I really didn't have anyone to turn to should I have had a complication. So I remember calling up Devinda Grover in Dallas and saying, you know, I really need to just talk to you about this case that I have going on, or to Tosin Smith and to Dr. Feldman. And I mean, the level of their graciousness is something I will never forget, and something which even at this stage of my career, you know, I think you get inspired every single time you run into something like that. But their graciousness and their ability to be generous with their time and their expertise has been fascinating to me, and has been so beneficial in my own trajectory of learning GAT.
Yes, and that's so true. You know, we stand on the shoulders of giants always, and we pass that on to the next generation of ophthalmologists and doctors as well.
And I think I'm just going to add that one of the things that you had said in terms of, you know, what would we say to younger ophthalmologists? I think as you and I have gone through our careers, we've also realized that help is out there. It's available. It's yours for the asking.
Absolutely.
But, you know, that I think you must be motivated to ask and to genuinely want to learn. And I think as long as that's there and you take that step and you ask someone, I don't think you're ever going to not be helped or not have help available to you.
Especially in today's hyper-connected world, there's so many options, and that is very available. One of the questions somebody asked me after your talk yesterday, and I just wanted to bring it up here, was the difference between a phakic and a pseudophakic eye when doing GAT. Certainly, from my experience, of course, pseudophakic eyes are quite easy. Do you do a lot of phakic eyes for GAT as well? And what's your experience been with that?
I do. I do a lot of phakic eyes, and I find that there's really no difference. The only difference is that I think you have to be more careful about not hitting the lens, right? But but I think the great advantage to us is that we're all phacosurgeons also. And so we're so used to working in the anterior chamber. And the nature of our patients who come to us for phacoemulsification is often more complex, given that they've got glaucoma, given they have their own ocular surface issues and multiple other coexisting issues that are there. So I think it's really an issue of proprioceptive skills, and there's just so much that's available now to be able to practice. And in fact, I would say that anybody who wants to transition to doing GAT, the end of your phacoemulsification procedure is probably one of the best times you can get into the angle without causing any harm to the patient, and also get the ability to get comfortable in there. But optics for microscopes have increased so dramatically. You know, the lenses that we have available, whether we have the Swan-Jacobs or we have the AMA DVX, and all of these individuals. I mean, iCamera is, I think, one of the most helpful individuals that you could probably run into in ophthalmology, and perhaps tremendously motivated. Ashim Shabani and all of these individuals.
Absolutely, yes. And like you said, the help is out there.
It's out there.
And you must have the hunger and the thirst to look for it, and always to strive to go forth and be better every day. Absolutely. So, and how's your experience been at ESO this time around? It's wonderful to have you here. You know, I'm sure that we'd like to hear what your experience has been. And
I think it's been a wonderful conference. There's been so many good speakers, so much good content. It's interesting how much more content you're able to get onto the two screens in the main hall.
And this is very true.
And that sometimes, you know, you're listening to a particular talk, but something from the corner of your eye and your visual field engages you, and then you can switch back and hear what's on the other side as well. But it's been great. I think the organization has been excellent. The timing, the hospitality has been wonderful. And I look forward to coming here again.
Fantastic. No, absolutely. I find, like you said, that with the two screens, you get the best of both worlds. You're almost listening to two lectures at the same time. And you pick up little bits of interest from both, and you're getting
I think it's a
twice the
drive,
learning, I think.
drive towards efficiency.
That's true. That's very true. Well, Dr. Mahnaz, thank you so much for
Thank
taking
you.
time to speak with us and speak with me today. And it's really lovely to have you here.
Thank you.
And we look forward to having you back at ESO again next year.
Thank you. It's been an honor for me, and I've had a great time talking to you.
Thank you very much.
Thank you.
Thank you.
Thank you.
And thank you to all our participants for participating at ESO as well.